So we start to have a modified system based on the Spanish and United American experience in order to improve this critical pathway. This is based on the last year result. I don't know, Dr. Shaheen mentioned it is old one. It is 2015 data. So out of 629 reported case, we came out with 89 harvested or actual deceased donor. And the aim of this program is to improve the identification and reporting process. We believe 600 is not the real number of all suspected cases. We estimate the number of deceased donors from brain deaths is more than 1,200 cases per year. So almost we are losing 50% not identified, not reported to Saudi Center for Organ Transplantation. And also to try to improve the conversion rate into medically documented and according to our protocol by increasing the percentage from 50, 60% to 80% as any international standards. So now we have the approval from the minister as also director of health, all health facilities in Saudi Arabia to appoint in every hospital, we call it donor medical coordinator, HDMC, in every ICU, in every donor hospital in the country. Of course, should be independent from transplant team of qualified physician working as full-time in the same ICU with the responsibility to coordinate with Saudi Center for Organ Transplantation and collaboration with the regional office and to apply the agreed protocol in ethical rule in the directory and to ensure proper donor identification management and to identify area for improvement in their field, in their hospital or region as well. So this 6 basic standard is very easy for somebody aware about the practicing the DBD. In order to initiate the pathway, we have to identify and notify. Without notifying the case, we will not reach or will not follow with you any suspected cases. In addition to that, very important, we need an administrative coordinator because the difference in our coordination system based on compared to the international programs, that the ICU doctor is not involved here in Saudi Arabia to approach the family for organ donation. His duty is to inform the family about this declaration, but it could be very good help for the administrative coordinator to collaborate with him for organ donation. So we don't need from the intensive care to approach the family for organ donation. We need an administrative coordinator to approach donor family or about organ donation, and of course follow up post-donation care and providing any support for donor family after donation, which is also very important. This is the basic what we need from any ICU practicing the deceased donation, from early reporting, early detection, adequate and optimal maintenance, and early declaration of death according to our national protocol. So we call it the MCIS project, Maximizing Cooperation between ICU and SCOT. This all document will be available in every ICU, including the national protocol, the guidelines used for management, the consent form, the fatwa, and the memo of the minister in one file. And this project was launched last year in May 2015. And just compare the last year, 8 months, with the year before, we have good increase in number of reported cases, good increase, significant increase in the number of declared brain deaths, with the rate of consent for donation about 30 to 34% of cases. And this is, of course, affected the number of transplanted organs. If you compare the 2014 with 15, we have significant increase in the number of kidney transplantation, liver, heart, and lungs. Appointing donor medical coordinator is not enough. It should be rewarded. And after a long discussion with the Ministry of Health and all other institutions, is to appoint a extra duty time or to appoint a full time only dedicated for donation. We came out with agree from the IRB meeting, the committee, the ethical committee, that they give us the permission to pay as extra duty for the DMC as well as the DSE, for medical coordinator and administrative coordinator. Anyone who report a case from any ICU, they will receive 1 unit compensation. To complete the documentation, they will receive 2 units. And when we have good maintenance, proper maintenance, is 2 units. And then for family approach, if we obtain consent, 4 to 2 units, big challenge for Saudi families. So we give double if they obtain consent from Saudi donors. Of course, we know that the rate, we cannot change the rate of refusal within 1 or 2 years. So currently the rate of refusal is around 65% of cases with family rejection. So even if they approach the family and we have a rejection, the administrative will be compensated with 1 unit. And once is organ recovery done in this hospital, we know there is a very complex logistic to be done in the donor hospital. So 2 units will be assigned between medical and administrative coordinator. And in case of non-recover, if you have sudden arrest or for any reason the family take the consent, we will give a 1 unit for the medical coordinator. So of course, shouldn't be the same person. We don't need a dictator in any ICU that all unit to be in his name. It could be the DMC assigned to report the case, but the 2 other physicians to help in the complete the declaration to be 2 other names, but should be from the hospital or donor maintenance. So you have 5 to 6 units allocated for every single case reported, documented, maintained, and approached. The unit estimated at or agreed to be 500 riyal based on the average salary for small hospital and medium-sized hospital. They found that the committee came out with the 500 will be accepted as 1 unit for reporting, 1,000 riyal for documentation, and 1,000 for maintenance, 4 unit for family approach, and 2 for recovery. Also, there is 1 new memo came out from the Minister of Health to all health sector as well, that every ICU should send a report, monthly report to Scott about the total ICU admission on ventilated and the case apply on the critical pathway, how many cases they report, how many deaths also, because we are going to establish a national survey about the number of deaths reported from ICU, maybe to come out with the real figure about what is the potential of all deceased donor in Saudi Arabia. So currently this MCIS is available on our website, scott.gov.sa. You will find the MCIS, 1 entity, and once you open this entity, you have all standards, definition, and form to be filled in every ICU. Also, we start to have online application of this brain death in order to avoid any duplication for filling the information about brain death cases. So every hospital will enter online and fill the form, save, and Scott will be notified immediately with the regional office and the assigned DMC. We start with the Western region in Jeddah in April, and we expect to launch it by beginning of the January 2017 if we have the appropriate budget for it. Before to conclude, just also important issue done by Scott is that we succeed to include the donation process under CBAHI, and this is the National Hospital Standards. This is the latest issue in the January 2016, that currently as standard provisional of care, every hospital should have the process for donation, procurement, and transplantation of organ and tissue. And also as a standard for adult ICU and pediatric ICU, that every ICU to be accredited by CBAHI should have a process for detection, notification of potential deceased organ donor. And also as for patient and family rights in every hospital, the hospital leaders ensure that patients and family and staff members are informed about the choices and procedure of organ donation. Also, other successful one that last year we include, this is the continuous dilemma with our colleagues, especially in the Ministry of Health. If I have a right to switch off the ventilator, if I have the right to stop the inotropes for patient declare brain death, but family don't agree for donation. Now it is available under the MOH guidelines, ICU care guidelines. It's available on the MOH website. You have the do not resuscitate and include the condition. You have the permission do not resuscitate in case of brain death declaration. Also for withdrawal of care, you have the permission. It is included in the guidelines in case of brain death diagnosis. And this is the memo that apply to all health sector, including the Ministry of Health, university, military hospital, National Guard, security forces, that early notification of cases of brain death to Saudi Center to support the organ donation in the hospital in collaboration with Scott, and to facilitate continuous communication of medical and administrative coordinator inside the hospital. So I conclude that, ladies and gentlemen, that disease donation and transplantation is being utilized in Saudi Arabia, but remains suboptimal compared to Western countries. We need to maximize organ donation in order to reach self-sufficiency, but improving disease organ donation program require targeting mainly the ICU. And the application of this MCIS has a great potential for improvement the practice of disease organ donation. So you have the key. Thank you for your attention.